Muscle is your organ of longevity. Do not lose it. So I've just finished clinic today. I thought something really topical about health span, strength span, menopause and bone health. I'm Dr. Botch, a sports medicine consultant specialist with an interest in health optimization and longevity. And I had a lady today in her 60s. She came because she was worried about osteopenia. She's got a family history of osteopenia. Osteopenia being low bone density, osteoporosis being very low bone density with an increased risk of fracture. And she wanted to know how to prevent this. But turns out she had several risk factors for this, not just the family history, but also she's a smoker. She doesn't do any resistance or strength training. She's post-menopausal as well, which again is another risk factor. Luckily, she is on HRT, and I'll talk about one day about how that can help with bone health. And most importantly and most topically, she's on a GLP-1, and this one was Mounjaro. Now, we all know Mounjaro is great for weight loss, and actually she's lost a lot of weight. She's lost about 30 kilograms. She's not had a pre and post DEXA scan, so there's no way to know accurately how much of that weight she lost was muscle and how much might even have been bone. So it's really important, if you're starting any of these GLPs, to do it from a health professional who can guide you with the right amount of protein loading and increasing your resistance training to maintain your muscle. Muscle is your organ of longevity. Do not lose it. If you can have the opportunity to maintain muscle whilst losing weight, you'll be much healthier. But if you don't, you'll just be smaller but fatter inside, and that puts you at increased risk of chronic disease, increased risk of cancer, increased risk of diabetes. It's really important that you do it the right way if you're going to do it. But just a really topical conversation. And actually, one of my Longevity Docs colleagues, Wanda Wright, has released a book recently, Unbreakable, talking about exact right sort of things that you need to be doing if you're in that age group, postmenopausal or perimenopausal women. Go and have a look at that book. Anyway, that was my chat for today. See you later.